Take two.
My name is Bob Chatterjee. I'm a consultant spinal surgeon and I work at the Hospital of St John's and St Elizabeth's. I ended up doing medicine a little bit by chance, I suppose. My first love was catering and I wanted to become a chef. Catering is very much a thing about process. It's all about planning. When you come to medicine and surgery, there's a lot of planning involved, although everyone tends to concentrate on the operation itself. Actually, there's an awful lot of work to be done before you get to the operation. It's all about planning in advance. If you know what you're going to do, what the problems might be, you have to anticipate what might happen on the day. Although I was born and brought up in England, my parents are originally from Calcutta. My father's a doctor, a retired GP, and there was a lovely thing that my father and I used to do was that we used to go to the villages outside Calcutta, which are quite remote. And what we'd do is we'd sit there and hold clinics and treat people. And that's the first time I got involved really under the wing of my father doing some charitable work in India. When I went through medical school, there were lots of choices and you come across lots of things in your training. And what you really want to do is you want to find something that suits your personality and piques your interest. Because at the end of the day, you're going to be doing it for the rest of your life. And so, you know, you're only really going to get good at something if you have a passion for it. Spinal surgery for me has got two elements that really appeal to me. First of all, I mentioned about the technical skills required. You need good hands to be a surgeon. I'm good with my hands. I'm afraid as a child I was always messing about with Lego and Meccano. But I think the other part of spinal surgery, it's really about people. Unlike other specialties, problems with the spine, because it tends to affect your quality of life in general beyond the pain you might be experiencing in your back. And so spinal patients themselves need a lot of time in terms of trying to understand the issues and understand how their spinal problem affects them. You've got to try to help them get out the information you need to understand what's going on. And it's that understanding that really underpins your ability of a doctor. If you don't understand what's going on, it doesn't matter how clever a doctor you think you are, you'll never do anything worthwhile for your patient. Sometimes it's easy to forget the human factor in all of this. You need to have a very clear explanation of the problems that the patient has, but in a language they can understand. It's all too common for doctors to use gobbledygook when we explain things, and that's of no use to anybody, I'm afraid. You have to explain the range of treatments, and that way the patient actually gets a choice in terms of what they would like to do and how they would go about treating their own problem. The one thing you can be sure of, you may meet a patient for half an hour, but you don't know their life. You don't know how their symptoms fit into their lives. They're actually in the best position to decide how to go about treating themselves. I like the patient to be fully aware, in charge, and informed about all the options available to them.